Doing big things is never easy, but we have made a promise, and we're going to keep that promise. We made a promise to repeal and replace Obamacare with conservative solutions and reforms. That is exactly what this bill does, and that's why we're here.
All right, that was Speaker Paul Ryan earlier today talking about the Republican plan to now repeal, replace Obamacare, but not all GOP lawmakers are on board with this new legislation. Joining us now is the Health and Human Services Secretary, former Congressman, somebody I've known for a while, Tom Price. By the way, congratulations, Congressman, on your new position.
Thanks, John. Thank you so much. Wonderful to be with you.
I know that, I guess my surprise, and if you look at the criticism from the Freedom Caucus, Rand Paul, Mike Lee, Ted Cruz, Marco Rubio, these are significant conservatives, also conservatives on radio. And I had interviewed you a long time ago about your specific plan. And I guess what is so kind of shocking to me is that all these criticisms were out there by conservatives before the bill was introduced. Why wasn't there a meeting and a consensus built on the bill within the Republican Party before it was released?
Well, it was released by the House, as you know, but we've been working with members of the Senate, members of the House, stakeholders all across the land about this piece of legislation. I think we've gotten to a pretty sweet spot. Now, this is a work in progress and continues to be so. But the core is that Obamacare has failed, as you well know. We got costs that are going up. The access is going down. It's only getting worse. You got insurers pulling out of the market. Premiums are going up, deductibles are skyrocketing, so people aren't getting care or coverage right now in the individual and small group market.
Yeah.
This bill addresses just that by providing the kinds of access to care and affordable coverage that individuals need.
I guess we all agree on a repeal. I guess the replacement is where the disagreement within the Republican Party is. What I don't want to see happen, Secretary Price, I'm used to calling you Congressman, what I don't want to see is an intramural civil war with Republicans over the bill. For example, the big criticism is it's not a full repeal, A, and B, that it's a new entitlement program. And one of the things one of the Freedom Caucus members told me today is they would rather block grant any money for the uninsured or the poor back to the states. Would that be something you'd be open to?
Well, we're talking about tactics and that thing, but let me make clear to people that this single bill is not the entire plan. There are three different phases. One is this bill that has to go through reconciliation because it's a budgetary process. Two is all of the kinds of rules and regulations. You remember all the things that the previous administration did? Hundreds of rules, thousands, literally thousands of guidance letters. We're going to go through every single one of them to determine whether or not they help patients or hurt patients. And if they hurt patients, we're going to do our best to get rid of them. And then the third phase is another piece of legislation that can't be done through reconciliation because of the specific rules. Those are the kinds of things that we're going to do in those phase 2 and 3 to purchase across state lines, to put in lawsuit abuse reform, expand HSAs in a more vibrant way. All the things that we know will actually bring down costs and allow individuals to get the coverage that they want for themselves and for their family.
I guess because a lot of people thought the 123-page bill was the bill, and I guess that's the reason. Mr. Secretary, let me ask this question, because one of the things that some conservatives are asking, and I think it's a fair question, every Republican voted for a repeal bill in and of itself in 2015. Why not do that again so you ensure all of it is gone? Is that possible?
Well, I don't think that the governors of the states would allow that to happen, because what they would see then is that repealing the programs that they've used to try to cover their most vulnerable populations and not then being able to know what the future holds, that's not a viable proposal. And the president, as you well know, has said repeal and replace. We're going to do them concurrently and move forward. And that's why it's important for people to recognize the three different phases: the bill, the rule changes, and the secondary bill.
Is there a new entitlement in this bill? In other words,
Absolutely not. What we're trying to do, Sean, as you well know, is to equalize the tax treatment of health coverage for folks. We've said that for years. Conservatives have said that for years. If you get your coverage through your employer, which is about 175 million people in this country, you get a tax benefit because that's paid with pre-tax dollars. The individuals that are out there in the individual and small group market, they don't have any tax benefit. We're trying to equalize the tax treatment of health coverage for folks, and that's the way that we think makes it much more fair for all individuals across this land.
You know, in the last segment, we had Dr. Josh Umber from Wichita, and it's somebody that I've known for a lot of years. He's a really smart guy. He's from Wichita, Kansas, and he started this cooperative, and it's been duplicated a lot around the country. In his cooperative in Kansas, They have a $10 monthly charge for children, a $50 monthly charge for adults. It includes unlimited health care. He has independently negotiated with the pharmaceutical companies for the major drugs that his patients need and gets 90% reductions. And then most of his patients have catastrophic plans, which are relatively inexpensive based on what your deductible is.
Correct.
In case you have a heart attack, an accident, God forbid, or cancer, God forbid. And that is the best, that's what insurance seems to really be for. Can that be duplicated? For example, could the Bricklayers Association of America, carpenters unions across America, is that something that maybe could be duplicated, considering it's so impressive to me, on top of the health care savings accounts, which we all agree we need in this bill?
Absolutely. What a great model to follow. And the flexibility that we have in this legislation and that we will have in the second and third phases, the flexibility that we'll allow ought to be able to make it so that that could be a model for anybody that wants to do that. Right now, it's virtually impossible, and that's not that's a program that may work for government, but it doesn't work for patients, and that's where we need to have our focus.
Last question, Mr. Secretary. How much input, those people that have been vocal and critical today, the Freedom Caucus, those senators that I mentioned, these conservative groups that I mentioned, Heritage Action, Club for Growth, Freedom Works, Americans for Prosperity, how much input will you allow them to have as you move forward in these three phases? Because a lot of them were pretty upset today.
We're looking forward to working with every single person as we have to date and folks who are interested in moving our healthcare system in a direction that puts patients and families and doctors in charge. And we're in the receiving mode for the kinds of reforms that people think need to be put into place through the regulatory process, through the guidance process, through the third piece of legislation, that third phase that will be necessary. This is incredibly important, and it's such an exciting time to be able to respond to the concerns of the American people and the dictates that they have, the requirement that they have to make certain that we address our health care system.
Oh, look, this is a defining moment for the Republicans and certainly for the president. The fact that you're going to have an open door and these people will be heard and those changes are going to be made, as you said, this is a first step, is a little more reassuring than how I felt earlier today. Mr. Secretary, I look forward to continuing this discussion as we move forward, and I wish you the best of luck. It's important we get this done, but get it done right. Thank you, sir.
We've got to get it done right. Thanks so much, Sean. Take care.
All right, appreciate it. All the best.